So I'll divide this according to three aspects. One is in adults, the other one in children, that is below 1 year of age. So the first thing, whenever somebody is choking, the first thing to do is call for help. So immediately you see somebody is choking, you call for help. If somebody is with you, you ask them to call for help and you start the process of first aid. If nobody is around, you have to make a call and then start the first aid. If you are the person who is choking, then also, if possible, you try to make a call or try to call for help before you do the procedure on yourself. So in case of adults, what we do, a procedure is called as a Hemline Maneuver. What we try to do is, if the person is choking, as I told you, they will be having universal sign called as clutching. You don't ask them whether are you okay. You ask them whether are you choking, because patient can have respiratory difficulty because of an asthma or because of any other causes. So if he not says that it's because of choking, then only you go ahead with choking maneuvers. Otherwise, if you go on doing choking maneuvers for some other respiratory illness, it is going to worsen the things. So what we try to do in Hemline Maneuver is, you stand behind the person who is affected with the choking, and you have to put your one foot in front and one foot behind, or in between their legs you stand, so that you have a stronger support. You make a fist, and you put the fist, you make a fist and put it behind, above the navel of the person from behind, and you grasp it from the other hand. It has to be just above the navel, and one shear pressure, pressure should be inwards and upwards. So you give this pressure, and because of this pressure, intrathoracic pressure, whatever food contents or any particles, that will come out. So this is called as abdominal thrust or Hemline maneuver. So why do we stand in a different ways? If the person eventually becomes unconscious, he should not fall on you and you should not get hurt yourself. So you have to support yourself first, hold it this way, make a fist and give a good abdominal thrust so that the choking particle will come out. Because this maneuver is so important, because this is anatomically creates such a good pressure. So even if it is a complete obstruction, there are chances that it can relieve the pressure. Suppose the patient becomes unconscious or unresponsiveness because of complete choking, then this maneuver won't help. So you have to make him lie down on the flat surface, and you have to start the cardiopulmonary resuscitation. That is nothing but chest compression. That's a completely different aspect. So this is in terms of an adult choking scenario. So what you have to do is just give a Hemline maneuver. Suppose a child below 1 year of age has a choking problem. The first thing to do is, do not blindly sweep the mouth of the child, because what you can do is you can further push the foreign body inside. So if the choking material is seen outside, you can pull it out, but do not blindly sweep. I'll show you a technique how we actually do the choking maneuvers in child. If the child is choking, you have to hold the child, support the child this way with your left hand, and make the child lie on your forearm and on thigh, and hold the child like this, little bit head and down, and with the heel of your hand between their shoulder blades, you have to give 5 thrusts. 1, 2, 3, 4, 5. So this is how. So whatever the choking material will come and get stuck here. So after the 5 thrust, you have to turn the baby. Still the obstruction is not relieved. Between their chest, breastplate, you have to hold 2 fingers and you have to give 5 thrusts. 1, 2, 3, 4, and 5. So this has to be continued until the choking material comes out of the child. So usually with these back blows, this particle will come out. If suppose with this back blows 5 thrust and 5 back blows, the particle doesn't come out, child becomes unconscious, then the child has to go for a CPR. Just like adult, you have to go for the child CPR. So this is the basis of an adult choking first aid and the children choking on the children having the choking. This is how you do it. This is the maneuver which has to be tried. Do not hold the child anytime this way. This is a common practice when we try to do, when the child is choking on a coin. That's what they try to do, and try to do back blows. It will worsen the blockage, and it can cause spinal injury as well for the child. So this is not at all done. So it always has to be back blows and the chest thrust.
So the child has to be put prone
Yes,
on the tile of on your tile when
yes,
you sit,
yes.
and then,
So when the child is prone on the thigh, you give 5 thrusts. Suppose the object comes out, you can turn the baby and take it out. Otherwise, after completing the 5 thrusts, you turn the baby and see if the object is in the mouth. Take it out, not blindly sweep again, and you make them lie again supine and give chest 5 chest thrusts. Still, the patient baby is choking. You continue the same maneuver again and again until the foreign body comes out of the babies.
and what about older children? Is it the Heimlich maneuver for them as well? For children
Wonderful
who are
question.
standing.
Yes, it's in above children of 1 year of age. It is the Himlich maneuver. Only thing is you have to kneel down in front of the baby, and the same maneuver at the same anatomical space. You have to give the Himlich maneuver, 5, 6, or 7 abdominal thrust, and the foreign body has to be taken out.